tell you that being a commissioner, I knew I needed to show up with a little bit of something prepared to say. And I'm just so moved by being here. You get to decide what's prepared and what is straight from the heart, although everything that I prepare is always straight from the heart as well. Just for a moment, let me ask a question. Who here is between the age of 1 and 10? Raise your hand. I'm not going to make anybody be embarrassed by the age categories. What about 10 and 25?
Me.
And Brown. 25 and 55. And over 55. Well, you were. And you know, one of the reasons I wanted to do that is because you don't always get the chance to talk to that many generations at one time. And then to have everybody in the same place at the same time, knowing that there's something in the message for everyone at the moment, and to keep talking about later. So I affirm you and all that you do, and the power of this organization. Keep growing and don't stop doing what you're doing. So I know I'm the commissioner, but I just wanted, and I have the, my biographies in the program, and then some people can look at all that and say, well, what does she really know? Because she's different from me. So let me tell you what I usually tell people. Oftentimes I'll start with, I come from the real world. And then they say, oh yeah, they don't know whether or not that really, I know what the real world is, but at least I tell them that. But just for the bit that I want to say, I also want to share with you some of the things that I've experienced that have been the real world for me, including being told from a very early age the things that I couldn't do because I was a girl, including being told not to become a doctor because no man would ever marry me, including being told I must be in the wrong class because it was an honors class. Well, I bet you there's somebody in here who's experienced something like that, and that's why I'm saying it. Including being told, why are you doing that? Black people don't do that. And through the course of life, I've counted pennies. I've kept my foot down so nobody could see the holes in the bottom of my shoes. And I've had occasions like other people where something so devastating happens, you wonder how you're going to make it through the next day. So, to me, that's real world. But I'm the Commissioner of Public Health, and I get to speak to you, representing the state of Connecticut, and telling you how important it is to me for this moment to say something that makes you walk out of here thinking that because I was here today, it's also going to make a difference for you. Because when I stopped taking care of patients one person at a time, one patient at a time, it was a sad time for me because I love taking care of people. And being a doctor, to me, is one of the greatest privileges you can have because people let you in their lives. And they tell you things they might not share with anyone else. But on the other hand, to have the responsibility for the health of everybody in the state of Connecticut is also an honor and a privilege. So because of that, knowing what I know about the health of women in Connecticut, there are a few things I want to mention. And I'll start with this. So I have on my pink ribbon. Everybody knows it's Breast Cancer Awareness Month.
Yes.
Now, I was already in a workshop where body anatomy was discussed, and I think it was done really well. We already had Kadara maybe you're thinking about things that people don't talk about, like abuse. And as much as people talk about breast cancer, and breast cancer is serious, and women are afraid of it, and it's so important to get screened, what a lot of women don't realize that the #1 killer is heart disease. And that if you think about all the women who die every year from heart disease, and then compare that to all the women who die from cancer, strokes, Alzheimer's disease, and accidents, that doesn't add up to all the numbers of women every year who die from heart disease. So I wear my red ribbon, and in February I wear my pink dress, and sometimes for heart disease awareness, and sometimes I try to think, just because it's like Black History Month, it should be all year, breast cancer awareness and heart disease awareness ought to be too. But then, those are the easy things to talk about. So particularly in 2013, it's important for me to do a couple of things. One is, this is not going to be a reminder about overweight, obesity, and being physically active, unless somebody wants me to really preach about that. Because I think everybody gets the messages and the risk for those things. So instead, I want to talk about HIV for a minute. Because I don't know whether or not many women realize that Black and Latino women are 20 or 12, depending on whether or not you're Black or Hispanic, 20 or 12 times more likely to develop HIV than a white woman. Our risks are that much higher. So we have physician's assistants and nurses and counselors and social workers and so many professional women and wise women in the room. So as we continue to affirm one another, if we can also affirm one another to be able to say, we know how to ask ourselves, is that person worthy of me? And can I do what I need to do to protect myself from the unknown infections, even if somebody's telling me not to worry about it, then wouldn't that be another wonderful thing for us to do for one another? Because I still hear all the time about people who don't even know how to say no to a husband or a partner because they're afraid that they're going to lose them. A boyfriend, not a boyfriend, just somebody who looks cute.